This presentation is on young adult health, presented by Heidi Borowski, David Burns, and Megan Magula. We will be presenting the health concerns of the young adult and look at smoking in more detail. A young adult is someone from the age of 18 to 35. It is the time from the end of adolescence to the beginning of middle adulthood. The major tasks of this developmental stage include establishing lasting relationships, becoming more independent, preparing for the assumption of adult responsibilities, rights, and privileges. The major health risks and challenges among young adults include homicide, suicide, motor vehicle crashes, including those caused by drinking and driving, substance use and abuse, smoking, sexually transmitted infections, including HIV, teen and unplanned pregnancies, and homelessness. The goals and objectives of Healthy People 2020 include increasing the proportion of young adults with health insurance, increasing the proportion of youth with special health care needs whose health care provider has discussed transition planning from pediatric to adult health care, injury and violence prevention, reducing the motor vehicle crash-related deaths, reducing the number of homicides. In the area of mental health, goals include reducing the suicide rate and reducing the proportion of young adults aged 18 and older who experience major depressive episodes, and increase the proportion of adults aged 18 years and older with serious mental illnesses who receive treatment. Goals also include increasing educational achievement and the proportion of students who are served under the Individuals with Disabilities Education Act who graduate high school with a diploma. When looking at crime, goals include perpetration of violent crimes. Goals also include increasing educational achievement and the proportion of students who are served under the Individuals with Disabilities Education Act who graduate high school with a diploma. When looking at crime, goals include reducing violent crimes, serious property crimes, victimization of crimes of violence. Goals for substance abuse include increasing the proportion of persons who need alcohol and/or illicit drug treatment and received specialty treatment for abuse or dependence in the last year, reducing the proportion of adults reporting use of any illicit drug during the last 30 days, and reducing the proportion of persons engaging in binge drinking during the last 30 days aged 18 and over. Goals for prevention of chronic diseases of adulthood include reducing the proportion of adults who are obese, increasing the proportion of adults who engage in aerobic physical activity of at least moderate intensity for more than 300 minutes a week, or more than 150 minutes per week of vigorous, intensive, or equivalent combination, increasing the proportion of young adults who have used the oral health care system in the past year, reducing cigarette smoking of young adults, and increasing the number of smoke-free environments. Goals for young adults' reproductive health include increasing the females at risk of unintended pregnancy or their partners who use contraception at most recent sexual intercourse, sexually experienced females and males aged 15 to 44 who received reproductive health services in the past 12 months, adolescents and young adults who have been tested for HIV in the past 12 months, sexually active unmarried males and females aged 15 to 44 who use condoms, sexually active females aged 16 to 24 enrolled in Medicaid plans who are screened for genital chlamydia infections during the measurement year, sexually active females aged 16 to 24 enrolled in commercial health insurance plans who are screened for genital chlamydia infections during the measurement year, as well as decreasing the number of new HIV infections among adolescents and adults and chlamydia rates among females aged 15 to 44. The health goal explored further will be reducing cigarette smoking by young adults because, according to Edelman, Kutzman, and Mandel in Health Promotion Throughout the Lifespan, smoking is a leading cause of preventable death in the United States. Smoking cessation is the single most important counseling topic for all people because its potential to lower the risk of contracting many preventable diseases. Starting with the baseline of 20.6% of adults aged 18 and older were current cigarette smokers in 2008, The Target of 2020 goal is to reduce the number of smokers to at least 12% of adults 18 and older. The objective of the reduced smoking goal for young adults includes reduced initiation of the use of tobacco products, cigarettes, smokeless tobacco products, and cigars by young adults aged 18 to 25. Smoking rates of adults have declined from 1998 to 2008 from 24 to 8.3%. Evidence-based tools that drove the progress from the 1990s have not been applied with sufficient effort or nationwide. They have, however, been proven effective where implemented. These tools are still effective as reflected in the fact that many states have seen significant reductions since 2005. Between 2005 and 2010, 20 states using these tools have seen a tobacco use declines of 20% or more. Nearly all tobacco use begins during youth and young adulthood. These young individuals progress from smoking occasionally to smoking daily. Each day across the United States, over 3,800 youth under 18 years start smoking. Although much progress has been made to reduce the prevalence of smoking since the first Surgeon General's report in 1964, today nearly 1 in 4 high school seniors and 1 in 3 young adults under the age of 26 smoke. Nearly all tobacco use begins in childhood and adolescence. In all, 88% of adult smokers who smoke daily report that they started smoking by the age of 18 years. This is a time in life of great vulnerability to social influences, such as those offered through the marketing of tobacco products and the modeling of smoking by attractive role models, as in movies, which have especially strong effects on the young. This is also a time of life of heightened sensitivity to normative influences. As tobacco use is less tolerated in public areas and there are fewer social or regular users of tobacco, use decreases among youth. And so, as we adults quit, we help protect our children through leading by example. Progress is being made. Coordinated, multi-component interventions that combine mass media campaigns, price increases, including those that result from tax increases, school-based policies and programs, and statewide or community-wide changes in smoke-free policies and norms are effective in reducing the initiation, prevalence, and intensity of smoking among youth and young adults. In 2006, the prevalence of smoking among youth and young adults declined faster in New York than in the United States as a whole. The use of tobacco products by youth and adults also declined. Between 2000 and 2006, smoking among middle school students in this state declined from 10.5% to 4.1%. That's a 61% drop. Among high school students, it declined from 27% to 16.3%. That's a relative improvement of 40%. Annually, cross-sectional, citywide telephone surveys using the same measures as the CDC's state-based behavioral risk factor surveillance system. Starting in 2006, New York City implemented an extensive television-based anti-tobacco media campaign using graphic images of the health effects of smoking, a campaign that was aired simultaneously with the New York State anti-tobacco media campaign. Declines in the prevalence of adult smoking were observed during 2002 to 2004, coinciding with a tax increase and smoke-free laws, and in 2006 among men and Hispanics, coinciding with the first year of the city's media campaign. From 2003 to 2005, smoking among high school youth in New York City decreased substantially from 14.8% to 11.2%. That's a 21% drop, while the national rate remained unchanged at approximately 23%. Current health promotion efforts continue to target youth with media campaigns which allow people to visually see the harsh effects of tobacco use on the body. Adoptions of smoke-free laws, continuing to increase the availability of accessible, affordable tobacco cessation options, continuing to tax tobacco products at a level that increases the price to deter consumers from buying the products, and continuing to restrict the advertising and promotion of tobacco products. Health promotion efforts are being made in the area of neighborhoods where adolescents growing up in distressed neighborhoods and poverty are at risk for poor physical and mental health, delinquency, sexually risky behavior, Media exposure. Adolescents exposed to media portrayals of violence, sexual content, and smoking and drinking are at risk for adopting these behaviors. Health promotion can be seen through academic success and achievement. They are strong predictors of overall adult health outcomes. Proficient academic skills are associated with lower rates of risky behavior and high rates of healthy behaviors. High school graduation leads to lower rates of health problems and risk for incarceration, as well as enhanced financial stability during adulthood. The high school social environment affects students' attendance, academic achievement, and behavior. A safe and healthy school environment promotes student engagement and protects against risky behavior and dropping out and preventing smoking. Current health promotion efforts include increased focus on the use of positive youth development interventions for preventing adolescent health risk behaviors. Youth development interventions providing all youth with the support, relationships, experiences, resources, and opportunities needed to become successful and competent adults. There is growing empirical evidence that well-designed youth development interventions can lead to positive outcomes. Ongoing rigorous evaluation will determine what works, why it works, and how successful the interventions can be applied. Current health promotion efforts continue in the laws to prevent smoking. There's no smoking in public buildings, hospitals, entry and exit ways, schools, colleges, restaurants and bars, workplaces, prisons, gaming places, daycares, public transportation, hotels, and multi-unit housing. Current health promotion efforts include increasing tobacco screening and cessation counseling in healthcare settings, reducing the proportion of non-smokers exposed to secondhand smoke, eliminating state laws that preempt stronger local tobacco control laws, increasing the federal and state tax on tobacco products, reducing the proportion of adolescents and young adults in grades 6 through 12 who are exposed to tobacco marketing, increasing the number of states and the District of Columbia, territories, and tribes with sustainable and comprehensive evidence-based tobacco control programs, and increasing the number of states requiring high-tech tax stamps on all tobacco products. Despite the societal progress made toward these goals, continued progress needs to be made at an individual level through individual health promotion. When looking at health promotion for the young adult concerning smoking and tobacco use, the nurse is in a position to help. The nursing assessment should include a complete physical with emphasis on the lungs and the heart. Inquire about current smoking status. Are they a smoker, a non-smoker, or do they use other tobacco products? Ask about the home environment. Do others smoke in the home? Are there other people or pets exposed to secondhand smoke? When did they start using tobacco? How often and how much? Are they motivated to quit? A good assessment will allow you to know where you are starting and help guide where you are going with planning for the health of the client. Ask about current stress. Stress can contribute to substance use, including tobacco products. This is a time of many changes, characterized by forming adult relationships, becoming more independent, continuing their higher education, and is often a time of risk-taking. The health promotion plan includes potential nursing diagnoses. Potential nursing diagnoses for a smoker with no visible health problems could include risk for impaired tissue perfusion related to smoking, self-care deficit related to smoking as evidenced by tobacco use, risk for impaired gas exchange related to smoking, risk for injury related to smoking, knowledge deficit related to smoking as evidenced by tobacco use, risk for infection related to smoking. Additional potential nursing diagnoses for a smoker with commonly associated health problems could include activity intolerance related to smoking as evidenced by inability to complete activities of daily living, decreased tissue perfusion related to smoking as evidenced by poor capillary refill, numbness, tingling, anxiety related to smoking as evidenced by inability to focus, poor ability to cope, decreased cardiac output related to smoking as evidenced by pulse over 100 beats per minute and blood pressure over 120/80. Altered nutrition related to smoking as evidenced by excess or too little weight per body mass index calculation. Impaired gas exchange related to smoking as evidenced by oxygen levels below 95%. An increase for altered parenting related to smoking causing secondhand smoke. Nursing planning is based on diagnosis. If the person is a non-smoker, acknowledge the healthy choice. If the person is a smoker with no visible health problems, teach possible future illness, promote quitting, offer a referral, offer medication, and such as nicotine replacement. If they are a smoker with visible health problems, treat the current problems, promote quitting, offer a referral, offer medication, such as a nicotine replacement patch. If they live in a house with a smoker and they're exposed to secondhand smoke, provide information on quitting to take home if appropriate and safe to do so. Promote a healthy diet, exercise, consumption of plenty of water, adequate sleep, and alternatives to smoking. You want to promote a healthy alternative to smoking, such as identifying the times of days and triggers prior to smoking so they can plan ahead and have an alternative to smoking, something like sugarless gum. Reduce the amount of smoking daily. You want them to use a nicotine patch or gum. Call a supportive friend. Avoid places where people smoke socially. Make sure they keep an appointment for a follow-up with a physician. And keep trying. Setbacks are normal. Remind them to count slowly, take deep breaths, drink water, or go for a walk when they feel the urge to smoke. Upon follow-up, the nursing evaluation would contain a full physical, evaluate the progress with quitting smoking. If they cut back or quit smoking, encourage continued healthy behavior. If they did not quit smoking, find out if there's a knowledge deficit still related to smoking, as evidenced by tobacco use. In that case, you'd want to reteach. Reassess why, what is working, what is not working to quit. Re-provide information in writing, including a smoker's quit line phone number. Encourage them to quit, assess medication compliance, reteach the health concerns behind promoting quitting, and reteach and provide written materials on alternatives to smoking. To provide the best care as a nurse of a young adult, be aware of the stage of development, intimacy versus isolation, per Erickson. Growing independence and building relationships is characteristic of this age. Higher education, families, and careers. Usually, this is a very healthy time of life. However, they're still vulnerable to social pressures, and it's a time of risk-taking. Education, safe neighborhoods, and access to healthcare and health insurance all help improve health. You want to assess for positive and negative health influences at home, work, and school, including smoking, drinking, drugs, violence, sexual behaviors, nutrition, exercise, social activities, self-esteem, suicide, risky behaviors, wearing a helmet and using a seatbelt in the car, and continued education in their daily environment. Provide the best care as a nurse of a young adult by being aware of the stage of development. This is Erickson's stage of intimacy versus isolation. It's a time of growing independence, building relationships, higher education, starting families and careers. It's usually a very healthy time of life, but young adults are still vulnerable to social pressures, and this is a time of risk-taking. Education, safe neighborhoods, access to healthcare and health insurance all help promote healthy young adults. As a nurse, assess for positive and negative health influences at home, work, and school. Assess for smoking, drinking, drugs, violence, sexual behaviors, nutrition, exercise, social activities, self-esteem, suicide, risky behaviors, such as not using a helmet or a seatbelt, continued education, and what their daily environment is like. Nurses are in a unique position to provide education in areas where needed and follow up with clients to ensure goals of Healthy People 2020 are being met. As a nurse, what would you do to help a young adult with children to stop smoking? And what do you think is a good way to prevent young adults from ever starting to smoke that could be a part of your practice as a nurse? As a nurse, what would you do to help a young adult with children to stop smoking? Also, what do you think is a good way to prevent young adults from ever starting to smoke that could be a part of your practice as a nurse?